Yeah.
Okay, so we have a super exciting call today. We're with the Drive Medical team, and we're going to be looking at the amazing Drive Medical air mattress systems. These are really high-end mattresses that we're using, we're providing to customers, and we're super grateful to have Josh, Peter, and the team there up in New York with all this stuff to do live demos and give us kind of a walkthrough. So if you're out there and you're looking for an air mattress system, this will be a great video to give you some insight on what these mattresses do, how they work, and why they're really high quality and why you want one for your home. Air mattresses primarily are used to prevent bed sores, pressure wounds, and are normally used for people that spend the majority of time in bed. So with that being said, thank you everybody for joining in. And let's go ahead and get started.
Thank you, Sean. I'm Karen Lerner. I am Drive DeVilbus's clinical VP. I'm a nurse practitioner by education, and I maintain certifications in wound care and complex rehab. I'm an ATP. So Drive hired me just about 12 years ago now when we started as a manufacturer getting into more clinically complex products, including pressure. And my role was and is to make sure before Drive brings product to market, we make sure it does what we say it's going to do. So if we rate it for a stage 4 full thickness pressure injury, it means it's been under real life people, real life patients with full thickness pressure injuries, and our support surfaces has contributed to the healing of those wounds and prevention of other wounds. So we have, we're one manufacturer and we make literally over a dozen different systems. Today, I'm going to introduce you to not all of them, but a selection. It's very important that patients, whether they're in a hospital, a nursing home, a subacute home, rehab, wherever they are, that the support surface matches the patient. You don't want to put everybody who's at risk for a pressure injury on the same mattress. This country has a national pressure injury advisory panel. There's a subcommittee called the Support Surface Standards Initiative that formed in 2001. I've been a member since 2001. And the 2025 guidelines that were recently published include a statement similar to what I just said, matching support surface to patient, giving different residents the proper mattress is a very important part of their healing process. So I'm going to introduce you to a few. The first up is one Drive calls the Harmony system. And this is a blower-based system. Some people call this a true low air loss. While there is no real definition of a true low air loss mattress, generally us woundists will say the control unit has to blow at least 100 liters per minute. Generally, that's a generalized term. Drive's Harmony system is a 1,300 liter per minute low air loss system. So what you would first notice is when you plug it in, it's going to inflate the mattress, fully inflate the mattress in about 2 minutes, even with a body on top of it. So it's a very, very, very rapid response. So before I even get to the mattress, I will show you the control unit. So you connect it, you turn it on, you inflate it, and you have a bunch of different features. And this is all digital, meaning I can use my digits or my fingers to control it. And there's a weight setting here. And I can set it from about 75 pounds all the way up to 900 pounds. This is a 36-inch mattress. We standard make it also in 42. And then once I set it to the patient's weight, there's microprocessing technology built in, and it knows whether to put air in, take air out, keeping the interface where the body is touching the mattress below capillary closing pressure. And Pete just hold that up for me. And the capillary closing pressure standard that's used, enough pressure to occlude capillaries, which leads to ischemia, cell death, pressure injuries, is 32 millimeters of mercury. And that's been the standard for, over 40 years, and that is still the standard. And part of drive bringing these things to market is we own a pressure mapping system. And that's part of what we do, is make sure that that interface with a variety of patient morphologies, a variety of body positions in bed, we're always maintaining that at or below capillary closing pressure. Okay, so we have this sophisticated microprocessing control unit, and I set the weight, and I have a variety of things that I can do. The low air loss feature is always engaged. So the microclimate, or the patient's heat and humidity, right, particularly at the interface, is always kept at the right temperature. Hot, wet skin, I use my hands, hot, wet skin, right, it's soft and it's very prone to a little bit of pressure, shear, friction, it opens up. So in America, we tend to call powered surfaces low air loss. We just call them low air loss. And yet, in my experience, I can ask clinicians who've been prescribing these things for years, what's low air loss? And people sometimes have a difficult knowledge of actually what low air loss is. I've been doing this a while. So, over 40 years ago, right, we knew that pressure, we don't call them mystery ulcers. We know that pressure causes them. So we knew that we could redistribute pressure with all types of surfaces. And we knew that we could reduce shear strain, and with shear strain comes friction, with the shape of our air baffles and using different fabrics. But the one extrinsic risk factor that we weren't controlling was heat and humidity, right? So what causes a pressure injury? It's pressure, shear, friction, and heat and humidity. So low air loss was a feature that came later to keep that interface at the below temperature, at the skin interface at the proper heat and humidity. So if somebody is diaphoretic, somebody has a fungal rash, somebody isn't getting out of bed at all and they're perspiring heavily, true low air loss, 1,300 liters per minute, is very, very effective at keeping that body heat and humidity at the proper temperature. Some of the other systems that aren't blowers aren't as effective at controlling the microclimate. They may be equally effective at pressure redistribution, shear strain reduction, friction reduction, but this one is especially effective at heat and humidity. And that heat and humidity is being controlled all the time, regardless of what we push, use, and whatnot. Should I pause?
That's great. I think that's very, very good information.
And just keep talking.
Yeah, just go ahead and keep talking, because I think that, the information that you're providing right now is really important to kind of differentiate the quality of this mattress from other mattresses that have quote unquote low air loss, because it's a very general term, generally speaking. And so to really put a definition to it, I think is really important, because, it really is about the climate control. And the number one reason that people get readmitted into a hospital after getting out of the hospital is because of some type of pressure wound or bed sore. So that prevention process and understanding why one mattress is more expensive than another, because they all will see that term low air loss. And I think that it's very important to understand that this is why you're going to pay more for a better quality product, because you're getting more value and it's performing a lot more functions and has more features. And I think that's a really important thing for people to know, because the general term low air loss, I don't think people really truly understand, what that means, and some of the features of that. So that's really good information.
Terrific. Okay, so good. We're on the same page. So the other benefit of a true low air loss, a very powerful blower system, is, right, I always say, here on Earth, where I have gravity, unless somebody figures out how to levitate patients, I can redistribute pressure essentially two ways, right? I can do it with alternation, which I'll explain in a minute. I can do it with immersion, which is the body sinking into the medium, whatever it is, gel, foam, air, and the ability of, once I'm immersed, of that medium to conform to the irregular shapes of the body, envelopment. So either I can alternate or I can do it with immersion and envelopment. Tri-therapy harmony system does both. This is an 8-inch high mattress. It actually has 2 inches of foam underneath in case there's a power outage, but it's 8 inches high. And when you have a 1,300 liter per minute system, if I wanted to deeply immerse a body, 6 inches, because I really need deep immersion and envelopment, it's powerful enough to keep them off the bottom so that I can redistribute pressure without alternation. There are some people who can't tolerate alternation. I've slept on alternating mattresses many a night. It's kind of hard to get your mattress cyclically moving underneath you. So that's the other benefit of a true low air loss, powerful 1,300 liter per minute control unit. Okay. The other features benefit the patient, but they also benefit caregiving. So Sean talked about pressure injuries being a top reason for hospital readmissions, and preventing hospital readmissions as this country moves into a value-based system is one of the top concerns, right? It's one of the things that we look at. And there are features on this that can actually help hospital readmissions. And among them is seat inflate. So people often need to sit with their head of the bed up more than 30 degrees. And when you sit up more than 30 degrees, that puts excess pressure on your pelvic area. 80% of all pressure injuries occur in the pelvic area. By engaging seat inflate, I don't care how high, I don't care if you're sitting at 90 degrees, it gives an extra bolster of air, and the microprocessing technology senses the interface pressure so that there's no danger of that very vulnerable pelvic area bottoming out or having too much excess pressure. So somebody can sit upright 24/7 if they have to, taking that weight off their lungs, right? It's sort of a conundrum. Some people have to take weight off the lungs. They have COPD, they have CHF, they have dysphagia, swallowing difficulty, but they'll also have pressure injuries. You know, what do I do? So that's another feature built into our Harmony system. Some of the other features are greatly ease caregiving. So if you think about pressure redistribution, we talked about immersion and envelopment. So if I'm the caregiver, all right, I am literally a little old lady. If Pete's my patient in bed and I have to position him, turn him, change his adult brief, do wound changes, whatever it is, and he's immersed in the medium, oh my God, my back hurts just thinking about getting him up and out of that mattress, right? If I hit auto firm, where's my auto firm? If I hit auto firm, Pete is going to levitate to the top of the mattress, literally. And when I unzip this, you'll see it. But around our air baffles, the 20 air baffles that make up this mattress, not because we hate, nurses and our patients fly down and we want nurses that pull them up all the time. That is an evidence-based way of reducing shear strain and friction. And when I hit auto firm, those rounded air baffles act like rollers. And I can pull Pete or anybody else up so quickly and easily by myself without using torque, without hurting, without even needing to find a buddy. And life gets busy. And if I forget to disengage that, no worries. No matter what I push on this system, it always goes back to therapy. So it's caregiver proof. We know that caregivers are, they get injured a lot and whatnot. So it's another feature built in. So those are sort of the caregiving features. Now the therapy itself, we call it a tri-therapy system. So the first therapy is true blower-based low air loss. And we talked about those benefits: heat, humidity control, ability to deeply immerse and envelop if I shall choose. But it does have alternation. Sometimes the immersion and envelopment takes away the patient's ability to move themselves. Picture a huge beanbag chair on the floor. You and I can't move, and they won't get by it. But I want my patients to have buy-in. Alternation will alternate half the cells on a cycle, and I can set the cycle from 5 minutes, 10 minutes, 15 minutes, 20 minutes. I can choose the cycle time because maybe they want a firmer feel. Alternation is a firmer mattress than just one that is controlled by immersion and development. So they have a firmer feel, but it doesn't mean they can get used to every 5 minutes. That can be hard to get used to. I can start them at 25 minutes. And maybe when they go to sleep, move them to 20. And as they get used to the therapy, maybe I can move them to 10 or even 5. There is nothing in the medical literature, nothing telling you it should be every 5 minutes, it should be every 10 minutes, it should be 2 to 1, 3 to 1. There's nothing in the literature. We just know that cyclically offloading the body so that there's not enough time for pressure to cause ischemia, cell death, pressure injury works. It's one of the first ways as a body we were able to mitigate pressure injuries with alternation. So you have choice of cycle times here. And the way alternation works is you have to offload. You have to truly offload. You can't just have sort of an undulation movement. An undulation can have a benefit, but it doesn't offload. On drives alternation systems, and we know this with pressure mapping, we truly offload. And that's how we effectively redistribute pressure to prevent and treat pressure injuries. So that's 2 therapies: true low air loss, alternation. We added a third therapy. It's called pulsation. Pulsation isn't a true evidence-based way of helping to prevent pressure injuries, but there's a lot of anecdotal references to pulsation in the medical literature. What pulsation does is head to toe, immerse the body into the mattress about 50% more every 15 seconds. So you are pulsing into the mattress every 15 seconds. Now, what the heck would I do that for? When a body is immobile, your lymph, the liquid part of your blood, when you're not moving at all, tends to leak out of the vessels. And you get third spacing, you get sort of peripheral edema. And when you have, you've probably seen, if you ever visited somebody who's immobile, their hand will almost look like a glove because of the fluid that's leaked out. And when that happens, you're not getting blood flow to the skin. So you're more prone to pressure injuries. And if you have edema surrounding a pressure injury, you're really not getting pressure to blood flow to the wound. So that's a concern with anybody who's immobile. And people with pressure injuries are largely immobile. What pulsation is theorized to do? Again, there's sort of white papers, but no clear medical evidence. Is that pulsation impression around your entire body, and that will reduce that edema. The other way, my own practice that I've used pulsation is if there's a crying baby, instinctively you pick up that baby and you begin to rock the baby and it soothes them. I've had many an agitated patient, particularly with Alzheimer's and related dementias, and I put them on the mattress. And first of all, it's a bed of air, so you go, ah. But I pulsate, and that rocking every 15 minutes can reduce agitation. So it can really enhance comfort, even dignity, and help them go to sleep and stay asleep. So within one system, you have tri-therapies. So think about the different types of patients, the different diagnoses. Even one patient whose condition is changing as they move through the sequelae of their condition, you're able to treat them. So it's a very, very full-featured control unit. Because these things are plugged in a variety of settings. Hospitals, of course, have full generators, but not all nursing homes do, not all homes do. If power outage is a concern, low air loss air cells are ventilated. So if there's no power, they got holes in them, you're going to sink to the bottom. But again, 2-inch foam pads, so they're never resting on a bed frame here. But also for whoever set this up or delivered it or is responsible for troubleshooting, if the alarm is sounding or whatnot, we put in very intuitive alarms. So if this thing is alarming, at 2 o'clock on a Saturday night, the first thing you ask is, what's alarming? There are 3 alarms: low pressure, power failure, and system failure. Low pressure could mean that an air baffle in the mattress has come disconnected. It could mean that it's set on 90 pounds and you have a 500-pound patient. Check that out. It could be that there's power failure. And if you can restore the power, check your plug. They'll be on 2 inches of a dense foam, so they're not on the bed frame. And if it's system failure, it means there's nothing wrong with the mattress. There's some internal circuitry within the control unit that, so we replace the control unit until it can be troubleshot. So it makes for very, very simple troubleshooting. And if you own this system, there's essentially very, very little maintenance. There are filters on the bottom, a couple filters that need to be changed about every 6 months. Most people don't know powered air systems have filters. They do. And if they ever get a little noisy, you can hear how quiet this system is. Check the filters. With every mattress, provides extra filters. So don't throw them out. Those are extra filters that do come. Anyway, but it's very intuitive. If this plug gets chopped, it's not connected. You just replace this. It's a sort of a standard plug. So the maintenance is going to be wiped down with whatever you want. You can lock it to different width head frames. So it's a very, very intuitive, easy system to use. Now I'm going to show you the mattress. So standard size mattresses are 36 by 80. And this one is a 36 by 80. We also have it in 42. So cover materials are very, very important when we look at all kinds of fabric for all of our systems at Drive. And generally speaking, the more stretch I add, the more porous the fabric is. Stretch, and this is 4-way stretch, allows for deeper immersion and envelopment. And because these air baffles are very easily changed and replaced, and they don't have any foam, so I don't care if fluid gets to them, I have a cover with a tremendously high moisture vapor transmission rate. You'll see it abbreviated MVTR. So that if somebody, again, is extremely diaphoretic, goes through the cover, is constantly circulating air under the cover, wicks away that heat and moisture, and that's how I keep the interface at the proper heat and temperature. Now, I want you to visualize most patients, residents, clients who require this type of system. They are largely immobile, right? Or they wouldn't have full thickness pressure injuries. And most of them have some level of incontinence. So they will have an adult breathe. They may have a blue plastic chucks pad, a rubber line, incontinence pad, something, because keeping the linens clean and dry and wrinkle free is important. When there's an adult breathe, a chucks, a rubber line pad, even if they are completely breathable without any plastic or rubber, it's still greatly impeding the ability of any low air loss to control the microclimate in that area, because body heat and moisture can't go through all that. If I can't go through all that, I can't get rid of it by circulating. That's why every surface Drive to Vilbis makes has at least 2 therapies. So if the ability of the low air loss is compromised by adult breathe, plastic, rubber, I still have another therapy going on. I have at least alternation and, or in this case, pulsation, so that your patient is always, always protected by some therapy. And some facilities don't want to use linens on these systems because they are afraid it's going to compromise therapy. In my own practice, I need linens. It's how I keep the cover somewhat clean. It's how I do easy caregiving. So you can use linens on Drive systems. And again, because there's always at least one backup therapy on everything we make, you're not compromising care. So we have a 4-way stretch cover. And by the way, all these components on everything Drive makes can be wiped down with a variety of cleansers, but also dilute bleach. Dilute bleach used to be what we needed to kill C. difficile, which is still a scourge in many, many facilities. And then COVID came around, and good old dilute bleach also killed COVID. So we want all our fabrics to be able to be wiped down with dilute bleach, and they can. Now, there's so many new cleansers on the market since COVID came around, and during the COVID pandemic, people would send me, can I use this one to clean a cover? Can I use this one to clean your covers? And we sent them off to our factories and we asked. And so far, I haven't come across one that our covers on any of Drive pressure products are intolerable. So a wide variety of cleansers can be used to wipe down our stuff. You can also unzip and throw it in the wash. And we give you the temperature that you do that at in our owner's manuals. We just encourage no heated drying because you don't want to destroy the ability of the stretch. All right. But if somebody poured dilute bleach for 6 hours and it got stained, you can always replace components individually. So that's our cover. Now underneath, and you see we have 20 air baffles, and they are held together with this translucent fabric, and that makes sure even no matter how heavy my body is, I'm not going to have separation at the cells. And we purposely run all of our air cells east and west, south, because east and west, this is an evidence-based way that the NPIEP S3I says you get more body, even immersion and envelopment. When they run longitudinal, you tend to get sort of internal rotation of hips and shoulders. So this enables body to be immersed and enveloped. The shape is very specific to reduce that shear strain and friction. Our seams on our baffles are actually welded thicker than most, and that's how we get such high weight caps. But if a box cutter, I don't know, something destroyed one air cell, these have quick release snaps, and I can pull out one air cell even with a body on it, and replace it if I needed to. And that's on virtually all of Drive systems. So maintenance, cleaning is very, very easy to do. Pete, did I miss anything on our Harmony mattress? So that's our Harmony, Tri-Therapy Harmony system. Go ahead, Sean.
Karen, phenomenal product, like absolutely phenomenal. There's features that you've mentioned, and I want to go back in and just go back over a few of this just to get a little bit deeper for the people that might be watching that aren't quite as familiar. But I've never seen a feature that had a chair position. Okay, and that's a big deal because it's exactly what you said. You're literally wedging all the way to the person into a very small section of the mattress. And on a lot of mattresses, bottoming out is a big problem. And so to have that feature set up where you're putting all that extra, support for a chair position is really important. And, I know you covered some of it, but, for a person to regain and maintain good health, bodily circulation is very important. A chair position is a very important feature in the recovery process. So sitting upright and being in an upright position is very important just for maintaining good health, as you said. And then there's certainly cardiac related issues that go with that and other health benefits, but that is a really big deal. Now, one of the things that I also wanted to ask you that we were talking about, sometimes people have a personal preference, we'll say, to the firmness of a mattress. And one of the first things you talked about is entering in the patient weight. So we'll say, as an example, the person's 200 pounds and they feel like, oh, I wish it was a little firmer, a little softer. You technically could then go in and say, okay, the person's weight is 225, or, make it a little firmer, or 175 and make it a little bit less. So you have the ability through that feature to modify the firmness. Is that correct?
That is absolutely correct. And the way I explained it is there has to be some clinical inference. Pete's probably 8 inches taller than I am. If we weighed the same, right, and I'm a woman, so more weight is concentrated in my hips, Say we both weigh 150. You might want to put me at the 200. He's tall and lanky. You may want to put him at 100 pounds. And again, it doesn't have to be precise because its sophisticated system knows how to put air in, take air out to keep that interface where it needs to be. So absolutely, you can adjust to patient choice and use some clinical inference. What I would caution, particularly if you're in a nursing home, is that's a favorite surveyor thing. Your patient weighs 150 and you have it set on 200. All I would say is document it somewhere, set where it needs to be set. And there is a lockout feature. So once it's set, the system will automatically lock, so there can't be, grandchildren or somebody fooling around with it. You just unlock for 3 seconds, and then you can fuss with the controls, but it does have a lockout as well.
I love seeing all the air bladders because the first thing that I look at is the first 2 air bladders. And I know with a lot of the products, and you could tell me, but the bottom of the heels is a pressure point that you're trying to really, and I can see that the way Drive is set up, that they've set that up so those bottom sections where the heel would sit down, you've got a curve there, which envelops more of the heel and prevents those bed sores on the back of the heel. So actually seeing underneath is actually really nice. And you could talk about that also if you'd like.
So thank you. So you're absolutely right? We talked about 75 to 80% of pressure injuries in the pelvic area, but the next 15% are all heels and lower extremity. And we know that. And we also know that, particularly in nursing homes, the nosocomial, the pressure injuries that they create are largely on the lower extremity. So in all of our systems, we really do pay attention to that. And the way microprocessing is designed, it's sort of zoned, right? There's a trunk, there's a torso, there's a pelvic, and there's a heel. But all of our systems are designed to offload pressure off the heel and redistribute it to the calf, which can tolerate a lot more pressure. Evidence-based way of reducing about 27% of pressure injuries. And all of our systems have that feature built in.
Yeah, that's a great feature. And then now also, now that we can see the air baffles, the alternating pressure is basically every other air bladder is inflating and deflating. And the goal of that is to change the points on the body making contact with the mattress. And I love the fact that with the alternating pressure, it's not locked into one specific time frame. You can adjust the time frame based on the comfort level of the patient and then adjust that because there is a little bit of getting used to some of this. And I do like the fact that you have the ability to adjust it based on the needs and also on the comfort level for the person that's actually in the bed.
I agree wholeheartedly. Without that, you sometimes have folks saying, get me out of this thing, right? And matching the product to the patient and getting that patient buy-in is very, very important part of their healing and their treatment. Yep.
Just to put it back out there, the pulsation or the submersion feature, it intentionally drops them down and then brings them up and pumps air, and that literally helps pump blood and circulate through the capillaries. So for people that are really immobile, that really can't move, that really does help push blood flow through the body. And that's another feature that's a really very advanced feature as well. And I think that, for people that see that feature on the mattress, I don't think a lot of people use it because I don't think a lot of people actually understand what it is and what the value of that is because, I sometimes I don't like to say it, but there are certain things that are very important for a person to have done. And I do understand that sometimes it might not be the most comfortable thing to deal with when you're actually in the bed. But from a health perspective, it's very important that you're actually using those features from time to time to really maintain good health. So even though it's a little bit, maybe awkward to be dropping down and pushing up, it's a very important feature for the overall wellness of the person that's in the bed. And it doesn't obviously have to be done for extended periods of time, but that is a very sophisticated feature to really help people that are immobile. We deal a lot with, spinal cord injuries and people that are either paraplegic or quadriplegic or have some other type of issue that's really minimizing the amount of movement. And to be able to do that, to maintain wellness and to also enhance the recovery phase of it is a very, very good feature. I don't know if there's anything else you want to put onto that.
So and I agree, and thank you for stating that so beautifully. Flaps and grafts, spinal cord injury and whatnot. The shear strain reduced on this Harmony system is also so tremendous that many facilities in the country have used it very successfully at preventing flats and grafts from essentially shearing off or from dying. Again, in my day, flats and graft surgery had about a 95% fail rate, honest to goodness, because these sophisticated systems didn't exist. And there are some other systems, that cost like $15,000 and up, that some old-time surgeons will still order for their flaps and grafts. And trust me, flats and grafts will also do beautifully on our Harmony system. It's that sophisticated a system.
Other thing I'd like to get into as well is talking about you really hit a key point with people that are already dealing with wound care, because you have the extra padding and you have a lot of extra material that's going to be in that hip section. And to have the extra microclimate set up for that to penetrate or to work with, the pads and some of the extra material that's there is also really important. That's a very common question we get. And to know that the mattress system is already identifying that and putting extra air and extra pulsation or whatever it is in that section is also really an important detail, because being able to get access to whisk away the moisture in that area, even through padding, is still very, very, very important in the recovery process. So that, is also a really great feature. The other thing that I think is great right now that you've taken that top off is that sometimes we do get people that might buy one or two extra covers, right? So sometimes instead of having to, try to get that cover cleaned off or worry about doing that real quick, where the person might be in a wheelchair or in a Hoyer for a minute, sometimes you can just zipper top that thing off and then go through the cleaning process, put another one on, and you can alternate those. So it makes it, you don't have to do it in such a rush, or you've got a little bit more time to, just go ahead and switch those out, which sometimes we'll do that as well. And you can see just by the way that that's set up, that it's a very easy system to just zip a top on and zip another top off.
I would agree. I call, one to wash and one to wear. And that was also something commonly I did in my practice, because life does get busy. And you want your beds looking neat and tidy, and you want your residents being on something neat and tidy. So good advice.
The other thing too is, we've got some of the dry products here, and I know that material that you were talking about, being able to get the moisture through that surface to whisk away the moisture, but also talking about a no shear fabric, so that when you're transitioning the person ingress, egress, or getting in and out of bed, that no shear is really limiting the amount of friction on the skin as you're doing those transitions.
And shear strain is more difficult to measure than pressure, but there's some evidence telling us that shear strain is more damaging to capillaries than strictly pressure, because it actually destroys them. And you can tell by the shape of the wound what caused it. And choosing a system that not only redistributes pressure but addresses shear strain can certainly help prevent and help heal that pressure injury. So absolutely, I agree.
We deal a lot with new, but we sell a lot of refurbished beds, and there is a lot of value into getting a hospital grade air system brand new. Like this mattress has features that some of the most expensive mattresses in hospitals don't have, because they're still producing technology that maybe was actually put into production 5, 6, 7, 8 years ago. With this drive product and with these drive products, you're seeing state-of-the-art technology that's available right now that you can get access to. And I think the other part of it, because we do deal with so many wound care is knowing that you're buying a product that is very high quality, that comes with a full 1 year warranty, and Drive has amazing customer service and support. The amazing customer service and support. So number one, the product is brand new, state-of-the-art technology. And then also knowing that you've got a full 1 year warranty, you're not worried about, a used system possibly breaking down, having an issue, but you're getting it at a price where you're getting hospital grade equipment that's got state-of-the-art features with really good customer support and not having to worry about having any issues. And that 2-inch foam layer is also a very important thing as well, because in this day and age, storms can hit or things can happen and you can lose power, but having that 2-inch foam base on the bottom basically gives you a little bit of a comfort zone to know that the mattress still has the ability to provide comfort or be, somewhat usable, even if there's a power outage and you're down for a few hours.